You're watching Between the Lines with your host, Dan Gray.
Welcome to another episode of Between the Lines. I'm your host, Dan Gray. Tonight, we watch in its entirety the meeting between Chat and City Council held at our last council meeting. I hope you find it as informative about addictions in our city as I did.
Under agenda item 5.3, Citizens Helping Addicts and Alcoholics Get Treatment, we have Dr. Paul Hergott, Lisa Foggia, Connie Rayner, and Rhonda Lee on the call. And before their presentation, there is a video that will be shown.
I want to welcome all of you to our meeting tonight. I want to appreciate the time that you're giving us and the presentation that you're going to give. I want to thank you for all of your work advocating on behalf of many people in our community who need assistance and support. So we look forward to your presentation. Dr. Hergott, I welcome you to introduce the group here with you, and I will give you the floor.
I think we're going to start with the video and then I'll get into the actual presentation.
Very good. Okay, so we will move to the video.
Are we?
My son came to the side door and he was sitting at the side door on the porch and he was crying, and he put out his arm and he said, "Mom," he goes, "I'm in big trouble." And he had track marks all down his arm. And that's when my world changed.
Wayne got a job at the steel plant and was doing very well. He's got a daughter, had a baby on the way. And we knew nothing about the drug issues in the Sault. I was like oblivious to any of wasn't in my mind. I never thought any of my kids would get into what's going on here in the Sault. When I did find out, Wayne had died.
There's no program at the detox at Sault Area Hospital. There's no program, there's no planning, there's no aftercare, there's no talking to parents of the addicted. I just picked her up and took her. Didn't see anybody, didn't speak to anybody, nobody spoke to me, and I just brought her home. And from that day forward, we took her every morning to go get her Suboxone. And when she had to detox, she detoxed here. It was the worst experience I've ever been through. I have never seen anybody in that condition. I've never seen her in that condition. Screaming, tortured by the pain of her body, vomiting, nauseated, headache. I knew that it was a disease, because when somebody goes through something like that, why would you want to use again if you're thinking with your brain?
I think for me, being in the position of chief of this community, obviously I hear from a lot of the families. I can see within my own community how a lot of the members are dealing with, that kind of situation within their lives. And again, it just doesn't reflect with the family itself, but it affects the entire community, right? And beyond that, I mean, even as a citizen next to our brother and sister here in Sault Ste. Marie, is that you see that on some of the streets. You see non-Indigenous people, dealing with addiction. You hear it on, some of the stories that people share. Like, this is not just a one race issue. This is a world issue.
I hear a lot of times, for example, we need to clean up downtown. Well, cleaning up downtown, it's like people as if they're not people. You clean streets with trucks. You don't clean up the people of downtown. To suggest that there's no funds there, I've seen so much money wasted that would make people's heads spin. And if it was put into the right areas, this would be an investment that would come back to the government many times over. This is one area where it's not just funding social programs and you kind of walk away. This is an investment, in my opinion, because the cost otherwise to our community and society will far outweigh the initial cost of funding that they're suggesting they don't have.
We're going to lose a whole generation of kids, my child, that didn't have to die because the help didn't come fast enough. There was no help to be given. And I believe Tia would have survived. She survived up until now. And she abused drugs for 15 years. And just the waiting. So you give them enough rope, they're gonna hang themselves.
And when people ask for help, it has to be now. It has to be now. It's not like, you know how devastating it is when you're having, like, you know, a mom crying or a brother crying because all of a sudden, like, their child or their brother or their sister or their parents are sick and we can't get them the help they need.
Good evening, Mayor and Council. I have with me tonight 3 of those mothers that you just saw who have lost children to the ravages of addiction. My name is Paul Hergott, and I'm speaking tonight on behalf of citizens helping addicts and alcoholics get treatment. Thousands of us who have come together in only a couple of months call ourselves CHAT, a grassroots group lobbying for a comprehensive strategy, a full-scale treatment facility to deal with Sault Ste. Marie's addiction crisis. As we have just seen, the stories are endless, the pain unending, and the cost immeasurable. I don't believe there is anyone here this evening who has not been affected in some way by alcohol or drug addiction. People with addiction have a disease that requires medical treatment. We must remember that these are sick people who are doing bad things. They are not bad people doing bad things. Addiction must be treated as a medical disease, not a blight on our community. Therefore, like all people with a disease, they need medical treatment with dignity and respect. Those who use drugs and alcohol are not just those visibly marginalized and living in poverty. The majority of people suffering from addiction are not visible. They are working and living among us every day. The lack of facilities and care has brought us to a breaking point. Sault Ste. Marie has the highest opioid death rate in Ontario. Algoma Public Health estimated that 60 people would die in 2020 in Sault Ste. Marie from the opioid overdoses. Alcohol-related deaths also ravage our city. These are harder to track because the cause of death is usually attributed to liver or heart disease. Crime rates continue to rise. Impaired driving, property crimes, thefts, violent assaults, and murder. The local Crown has 6 murders and 2 attempted murders before the courts at this time. They are all drug-related. At least 102 firearms were seized in 2020. As well, last year, close to $1 million worth of dangerous drugs were seized. Sault Ste. Marie Police Chief Hugh Stevenson tells CHAT that 80% of calls they receive are mental health and addiction related, the greater number being related to drugs. The police budget is around $30 million annually. Do the math. This is not just about death. It's about quality of life. Look around. You will see ravaged people, devastated families, and a community in despair, discarded needles, plummeting property values, sex trafficking, family breakdown, job loss, organized crime, and gang activity. Add to that the cost of responding to the civic emergency, police, ambulance, healthcare, the justice system. A continuum of care is desperately needed. Most communities in the North have a residential treatment center. We are the only community without a proper residential withdrawal management facility or a 28-day treatment center. Currently, we send our most vulnerable citizens elsewhere to access withdrawal and treatment, places where they have no family or support network. Having to leave the community may prevent someone from reaching out for help. This is especially true for single-parent homes. Figuring out aftercare is done on their own when they return from treatment. The wait for publicly funded treatment centers is currently 3 to 4 months, while the affluent can spend $20, $30, or $40,000 to get their loved ones into private facilities, others like Rhonda with us tonight are forced to sell their homes and belongings. The final insult is the cost of treatment is taxed. Until our full-scale treatment facility is operational, Sault Ste. Marie requires an adequate number of safe beds where people can stay while awaiting transfer to an out-of-town rehabilitation facility. Chat's #1 priority is to see our old detox, which closed in 2020, replaced with a new 20-bed residential medical withdrawal facility. The current makeshift detox at the Sault Area Hospital is woefully inadequate, and the screening process for admission goes against the whole philosophy of people self-admitting. In 2019, the Sault Ste. Marie and Area Drug Strategy Report was completed and released. It contained recommendations very similar to ours, yet nothing happened. Likewise, in 2010, the LHIN created a local group and funded them to the tune of $250,000 to look into the delivery of mental health and addiction services in Sault Ste. Marie. After 1 year, a 187-page report, the LHIN suggested merging all mental health and addiction services. They found fragmentation of care being given in silos, and that the focus needed to be client care. The recommendations were never followed through on because of the cost implications for the LHIN and the refusal of some of the major healthcare providers to cooperate. The status quo is no longer acceptable. The time has come to stop doing studies that repeatedly produce the same recommendations. The time has come to implement a strategy that includes, but is not limited to, in-town treatment. We need a medical withdrawal clinic immediately and a 28-day rehabilitation facility. We need safe beds, a supervised consumption site, increased access to the RAM clinic, increased Canadian Mental Health Association accessibility. We need increased accessibility to the East Street Addiction Clinic. In closing, I ask on behalf of everyone victimized by addiction in our community, how much was a life worth in 2020? How much will a life be worth in 2021? All levels of government need to take action now. We need more money to support the existing clinics, caregivers, and programs that are currently operating. We need to expand our existing clinic hours and days of operation. We need to break the barriers for people getting help at the hospital emergency and be able to guide them into care. Chat supports Council's Resolution 8.1, passed January 25th, requesting a residential treatment center for Sault Ste. Marie. I ask Mayor and City Council to show their support for what Chat is requesting this evening, so that we can move forward as a community with one goal and one purpose: to save lives. I would like to thank all the wonderful people who have joined Chat, those devastated by addiction, yet brave enough to share their stories, those who have stepped up to support them. Thank you to everyone who is fighting for change. I would also, in closing, I would also like to thank specifically Robert Peace and Rolling Stone Pictures for their media and public relations support, without which we could not have got the community behind us. We also have many other people who we wish to thank, which are posted on the slide. And Mr. Mayor and Council, I look forward to hearing your support for these suggestions.
Thank you very much, Paul. I want to just recognize and thank you and all of the folks that are involved in Chat for your advocacy. I feel like it's made a difference. I feel like we're seeing some progress on these issues that we haven't seen in a long time. But I want to recognize people that have been at this work for quite a while. Connie, you have been through SOIA. I want to thank you for all of your efforts through SOIA. I also want to recognize Donna DeSimon of Addictions and Mental Health Advocates for all of her work and that group's work. There's obviously a lot of people have poured themselves into this because they see the need in our community. And as Dr. Hergott correctly points out, I think this issue's affected each of us directly and indirectly. I'm going to save the remainder of my comments for the end of our discussion, but I do want to before I move to comments from councillors or questions from councillors, I do want to recognize Lisa and Connie and Rhonda here with us tonight, and I want to express our deepest condolences for your losses. I can't imagine that feeling of losing a child, and I want to recognize all the people in the community who have lost a loved one close to them over the last number of years. As Dr. Hergott points out, there was a report done in 2010 and another in 2019. So there's been, this has been a long-standing issue in, across Ontario, but certainly in our community for a number of years now. So I'll reserve the remainder of my comments after council's had an opportunity to discuss this issue or ask questions. Councillors, do any of you have any, okay, I've got a list going then. I'll start with Councillor Bruni because I saw his hand first.
Thank you, and thank you to Dr. Hergott for his presentation. I guess, Dr. Hergott, regarding the full-scale residential withdrawal treatment center, you said we're the only municipality that does not have one. What does the provincial government and especially our member of parliament, Ross Romano, what are they saying to you? I mean, you have direct dialogue with them. Is there anything you can share to tell us? What would the holdback be?
Councillor Bruni, that was residential medical withdrawal, you said?
Yes, residential.
Well, those are questions that I have started asking the hospital. I've had many meetings with Mr. Romano, and he has had meetings with the ministry. I'm not sure. It's up to me to explain what the holdup has been. That may be something that Mr. Romano can explain. There most definitely has been a holdup. The application went in June. It was hung up at the Lynn for quite some time. And my understanding is it really just got to the higher levels of the ministry in perhaps the last couple of weeks. So you are absolutely right. There has been a significant delay in this happening.
Okay. Thank you. Thank you, Mr. Mayor. I'll let the other councillors ask questions also.
Councillor Bezumal.
Thank you. It's more comments, and I just want to give a big shout out to all of you for coming together. It's when we all come together, especially with grassroots organizations, that we can really see some change happen. And I'm happy to do what I can in whatever capacity that could be. I also want to take time to really recognize Connie, my new neighbor on Gore Street. I see what Soya does, and we are neighbors. We're in the same building. And I want to let everyone know that Soya takes donations of socks and mitts and hats, and they give out soup every Saturday. And anyone that if they're looking to get involved, I think that's something that we can start. And I remember Luke and I both met Connie and Donna at shortly after our election when we had a open house at the soup kitchen. So really applaud what you ladies have done, and also anything that we can do. I see it every day. We have a lot of people that are needing help that come into Grocer for Good, and my staff are really excellent with them. They are like everybody else. They buy groceries, they need socks, they need help, they just want to chat. They talk about their pets and things like that. So I think that's the key piece is we're all human, and it affects every walk of life. And I really want to give kudos to the chief for saying that it's not about culture or socio-demographics. It's about all of us together. So whatever we can do, and happy to be part of that dialogue in whatever capacity that we can do to support that.
Okay, thank you, Councillor Vesmel. Councillor Hollingsworth.
Thank you. I echo everything I've heard so far from my fellow councillors, Dr. Hergott and the other team members. As a registered nurse, I have worked with those that unfortunately have become addicted to drugs and alcohol. So I am quite aware. Also, I do have a family member that unfortunately was addicted. However, I just want to say kudos to everyone that's involved. Dr. Hergott, my first question, please. Wonderful presentation. So what is the next step? What is your next step? What's your team's next step? You mentioned about Mr. Ross Romano, but what is on your agenda for the next step so we can become more involved?
Thank you for asking that, Councillor. We've now done our, I guess, our publicity, and we've got the message out. We are moving into action. I'm having a meeting tomorrow night, and I have about a dozen committees now that I want to form, and we're going to move into action. We're going to look into providing harm reduction. I want to have Indigenous relations. We're going to form a youth reach out committee and an Instagram page for the youth, and many, many more things along those lines. I want to look into a safe house, building a place, some place where people have a safe place with supervision while they wait. Chief Ricard and I have actually had some brief discussions about that. And I kiddingly suggested to him that perhaps we could build something at Garden River, a safe place where people could wait. So we have a lot of things now. We're moving forward into action, and we will continue to make noise and in specific areas. I hope that we're able to work with the hospital. I personally, last week, I'm still working in being involved in patient care. I personally had a very devastating experience in the emergency with a young heroin addict who was pregnant, no prenatal care. She had smashed her head open, had got it stitched. There was blood all over her. She had blood on her face and her hair. And I came to see her, and no one had even made an attempt to clean her up. And I did my best, but I could not lead her to a methadone clinic. And I did my best to get her obstetrical care, but quite honestly, I failed. I know she left and nothing was going to happen. So I'm hearing over and over again from parents like Lisa and other people, their children go to the Emerge, and that is the door. That is where our opportunity is. And I'd love to be able to work with the hospital and have them listen to what their barriers are. I know they're doing their best, but we need to see how we can get it a continuum back out into the community. I have a crazy idea, like we have a PAC clinic. Well, maybe we can have some kind of follow-up clinic where somebody follows up with these people in a day or two and sees how they're doing and did they get out to a methadone clinic. So we have lots of ideas, Sandra. This is not the end of us.
Okay, thank you. I have another question. Since August, I have also been reaching out to various groups in Sault Ste. Marie and actually throughout Canada to educate myself on what services there are available in our community and across Canada. So I have learned a little bit more about Elliott Lake, and I also learned about Blind River. Are you able to educate me further on, it's my understanding Blind River and Elliott Lake, they do have a residential detox. Is that my correct understanding?
Yes, Elliott Lake has a residential detox, which is actually attached to its residential treatment center. And that's Camilla's house, and it has been servicing Sault Ste. Marie for many, many years. And one of my members, Randy St. John, was the EAP at Algoma Steel for 30 years. And they kept a couple beds there. So they've been very helpful to us. And that small community has a treatment center and a detox. Blind River has an Indigenous-based treatment facility. I'm not that familiar, but I do know it is more earth-based, which is what my understanding, that the Batchewana band, when they open their treatment center, it will be more earth-based, but open to everybody if there are beds.
Okay. My third question. In my research, as I mentioned, since August, I've also reached out to a group in Alberta who currently is showing success rates, and they are now helping Winnipeg, the city of Winnipeg, to set up a center. And I'm just out of curiosity, have you and your team reached out to other successful facilities across Canada so we can learn other models that might fit into our community?
Was that models overall or for safe injection sites? I didn't follow that.
Oh, good clarification question. A model for overall.
We haven't at this, well, yes, I should say we have. Vancouver has recently set up a plan such as we're talking about. And I think the mayor has that too. He and I had talked about that. So the city of Vancouver has done it and has a great plan. And a big part of this, and Chief Stevenson is on side with us, is the decriminalization of drug possession. And the drug squad in Sault Ste. Marie, we've met with them. They're not interested in arresting these people. They just want to get the people dealing off the street. And I just spoke Saturday night with friends of ours. He's the former Chief Justice of Ontario, and he was talking about a mental health and addiction court that they run in Toronto. And they look at alternate management for these people rather than putting them in jail. So I'm not sure how I push the judiciary, but that's something else to consider here.
Okay, good. And I agree with you. Another analogy, another example is many, many years ago, our community, many members of the community realized we need a hospice. And the community came together, and we, as a community, created a wonderful, wonderful facility called Arch. I strongly feel as you continue to voice your concerns and your team and others in this community, I am confident that we will achieve this goal. The last comment is, Ms. Dr. Hergott, if there's anything I can do, please let me know. I've been in contact with the hospital, with Lisa Case and her team, who are doing a very good job as well. And I'm here, so please, if we can have an offline conversation, I'd appreciate that, Dr. Hergott. Thank you again for coming tonight, and thank you to your team.
Thank you. And I would very much like to take you up on that. And I would like to sit down and meet with Lisa and see what we can work together towards.
I like that. So we'll talk in a few days. Thank you.
Councilor Gardy?
Thanks, Mr. Mayor. I want to thank Dr. Hergott for the presentation and for Ms. Foggia and Rhonda and Connie joining. If I've missed anyone, forgive me. Those are those that I can see on the screen. Dr. Hergott, your group, I think, is going to lend a lot of heft to this lift. As you are aware, this council and a previous council through Mayor Provenzano have been advocating for some of these for these things, for facilities as you referenced, and you know, for whatever reason, it hasn't come through in as timely of a fashion as we want. The excuse from the province cannot be the pandemic, so I'm hopefully they don't use that, because this is an epidemic that has been in existence far prior to what we're experiencing with COVID-19. And there's nothing that really kind of gives emphasis or illuminates, you know, the issue more than those impacted directly from telling their story. And I'm proud to tell you that I know Rhonda quite well. And just for those who don't know Rhonda's story, I'm gonna summarize it real quickly. I want people out there to imagine that they're a parent whose son died because of addiction and an overdose, and then having to be in a position where another of their child comes to them wanting help, and there not being virtually any help for them in this community. And then, as you mentioned, having to go to press forward on your own to find a private institution and pay tens upon tens of thousands of dollars because there isn't anything else available anywhere. There was no public facility anywhere available to her. So I am, there's no excuse for the lack of the province coming through with this. I really think your efforts are going to kind of get us over the hill. I commend you for it. I know that Mayor Provenzano and all the community partners out there are willing to work with you, and I wish you guys nothing but the best of luck. And like everybody else, who I think will say the same as I, you have 11 allies on the table, and best of luck to all of you. Thank you.
Thank you very much.
Thank you, Councillor Gardy. Councillor Christian.
Thank you, Mr. Mayor. I also want to thank Dr. Hergott for his presentation. And I also want to take a moment to thank those through the video that presented their stories. I don't really think I have the words to effectively express my deep sympathy to you. It's through people like yourselves, though, that share your stories that help shine a light on the real tragedy that we're going through. And this is a disease, and it's frustrating because we could make a difference if we had the tools to do so. And it's particularly frustrating when we hear of smaller communities that have at least some of the infrastructure they need to deal with this. I just wanted to let everybody know, as the other councillors have, that I will support your efforts and support anything that you need us to do. And I volunteer my services as well. But I also want to make one final comment before I hand it back over. And I want the viewing public to recognize their small responsibility in this. This is affecting the entire community. I don't think it's fair for the community at large to say, yes, we understand that people have problems, and yes, we wish that they get the support. I think we all have to take some responsibility in trying to determine what it is we can all do to support a collective effort to get these facilities and the infrastructure that we need. And so I'll leave it at that. This is very, very important. This has a human economic toll in our community. And one of the presenters made the point that this is really an investment, and it is. Because if we could take a big chunk out of this problem, this disease, we as a community collectively will be that much better off. This is a priority, and we need to get it resolved. I know council's very aware of it, and I'm sure that we're all in full support of your efforts. So thank you very much.
Thank you.
Hey, thank you, Councillor Christian. Next, I have Councillor Dufour.
Thanks, Mr. Mayor. First off, again, I just wanted to thank Dr. Hergott and all of the mothers who joined us tonight. I want to commend you all for your grassroots efforts, and I'm very grateful and cautiously optimistic to hear of some of the progress, Dr. Hergott, that you've made in speaking with the province and in being able to have their ear. I know that in our conversations that hopefully you see and understand that you have a willing partner in the city and in the DSAB to do whatever it is in our power there is to do. And at the same time, I guess one of my questions for you is how do you feel about how the provincially based conversations are going? I know that there was an announcement last Friday, and I guess I'm just wondering if you can share with the community if you see that as a positive step and where you see that going for next steps.
Thanks, Luke. I see anything that brings money and help to the community as a positive step. As Mr. Romano himself said to me, it was a small amount of money, but it's helpful. And he and I have talked about his plan for the last several months. He is the Minister of Colleges and Universities, and he very much wants to create an educational center for addiction and research and a center of excellence, which ultimately I think will be helpful down the road. But in the next months or year, the programs are not going to be that helpful. What we need right now are things that will save lives now, like harm reduction. We need to increase our clinic hours and times. There's good people working, but the clinics aren't open every day. Some addicts have jobs and they can't come to an appointment between 9 and 5, alcoholics and other people. So I think it's a step forward. The last thing we need, as I said in my speech, is we don't need another committee to look into things. We know what the problems are, and it's time to move forward. And I've also spoken with Mr. Sheehan and put him on notice that we need federal help. It's not just a provincial matter, and we want to move forward with a harm reduction site. Mr. Sheehan told me he had spoken with the federal Minister of Health as well about our situation recently. So he as well has given us a letter of support, and we will be working with, it's at all levels of government. It's a responsibility of the council to keep the city safe, but it's not the position of council to provide healthcare. But we need to all work together, and our group has grown organically. It's just happened. It just happened, and as Councillor Hollingsworth said, this community is a good community. We raise money, we build hospitals, we raise money for CAT scans. And I think if we get everybody on the same page and having compassion for these people and not just arresting them and putting them in jail, but let's help them and fix the problem as a community, we will move forward. And that does require all levels of government.
Thanks for that, Dr. Hergott. I definitely agree, and I'm glad that you point out for us and for the community's benefit, that there are mandated areas of responsibility, and that the city cannot pay for healthcare with property tax dollars. I think that's an important distinction to be made. And as chair of the DSAB, our Social Services Board, I think it's important to point out that even though we can't fund healthcare, we can be a valued team member with the work that your group is trying to put forward. We have leveraged significant investments into our homelessness shelter system. Our staff at the DSAB are living on the front lines of dealing with the symptoms of this epidemic every day. Whether it's our staff from housing, our paramedics, even childcare workers, and especially those working in the homeless shelters, they're seeing this problem grow and grow every day. And it's become one of our number one concerns as an organization, yet it is one of those areas that we don't have the power to directly provide the services that you're advocating for. So I thank you for your advocacy, and I hope that you continue to push for those important resources that our community so desperately needs. And once again, if there's ever anything more that you need in terms of support from the municipality, anything we can deliver, we're happy to help. Thank you.
Thanks, Luke. And just if I could add a point, you and I and Mike Nadeau have met, and we know that there's no fine line between homelessness, mental health, and addiction. There's a huge crossover, and you can't isolate any one. So we look forward. We look forward to working with the new hub center and the bus. And but not all of people with addictions in Sault Ste. Marie are on the street, and There's other addictions that we need facilities to treat: gambling, sex addiction, etc. We need a treatment facility for everybody.
Couldn't agree more.
Okay, so I have two left on my list. I have Councillor Shoemaker who has a question and Councillor Nero who has a comment.
Thanks, Mr. Mayor. Through you to Dr. Hergott, perhaps Dr. Hergott, if you know the answer. In the early 2000s, there was a campaign to build the new hospital. I believe it was probably spearheaded by the Sault Area Hospital Foundation, but I know the city played a big role in it. The Stake in the Sioux campaign, I think it was called. Is there the possibility that such a campaign could be initiated in conjunction with provincial funding, obviously necessary, but is there the possibility such a campaign could be initiated to help get over any funding hurdles that there might be?
Thank you. That's a good question. And I don't see any reason why there can't be. It's a matter of priorities. We recently raised money for a new cardiac cath lab when we needed it. We raised money for other equipment. This is a medical disease that is being undertreated and we need resources. A former member of the foundation just told me on Saturday that the hospital sold the 3 houses that were adjacent to the building where Pauline's Place and the old detox were. So that money is going to the foundation now from selling those 3 homes. One of the Pauline's Place was donated to the hospital, and the old detox was donated by the members of AA to the hospital. So perhaps the money raised by selling those houses might be a good start to a base for building something.
Yeah, thank you. And I question through you, either Mr. White or the mayor, on that particular point. Is there land or other, serviced buildings that the city's got in its stock that could be, offered up as possible solutions to the issue of a physical asset being required?
CEO would have to answer that.
I'm sorry.
Through you, Mr. Mayor, to Councillor Shoemaker. The city itself does not own that type of asset. There are other assets in the community, and the city is working with Sault Area Hospital to help identify an appropriate asset for use.
Yeah, and I think, the point being simply that all of council, it sounds like to me, would be behind doing what we can to get the right assets into the right hands for this type of service. So thanks, Dr. Hergott, for your presentation. I know that others have thanked Lisa and Rhonda and Connie for being here, and your bravery in being able to share your story with us is very much so appreciated. Thank you.
Thank you.
Councillor Nero.
Thank you, Mr. Mayor. Some brief comments as well. Thank you, Dr. Hergott, for your presentation and your support and work on this project. We're all aware we have done, along with the mayor, a lot of work trying to push the province for these facilities for some time. I'm at a loss, as well as all of us, I would believe, why we have not had any response from the province on this so far. But I'm certainly in full support of your plan to move forward on this issue, and full support of anything as we as a council can do to help you on your endeavor to get this going. So thank you for your work.
Thank you.
Okay, Councillor Hergott, I apologize, Dr. Hergott. I'm going to wrap up here. Before I move into my comments, I just want to point out one I think salient point to this issue of raising funds and the capital you need to construct something. Nissinabee Cree offered $11 million to that effort. So in my mind, the capital was never really an issue. It was always, as I understood it, the operating costs of operating a residential treatment facility that was the impasse. And I don't know that you could ask the community to raise that on an annual basis. But look, first thing we have to do is thank you for your work. It's important work. I know you're taking a leadership role now, but There's a number of citizen leaders in our community that have been doing this work for years and have been speaking up about this issue for years and trying to get some traction for years. I think back in early 2017, I wrote my first letter in support of the residential withdrawal facility for Sault Area Hospital. And in the fall of 2017, I think then CEO was at City Council, whereby City Council supported it and then sent another letter of support. In the reality of this situation to me is fairly straightforward. We've needed help for a long time. And we have said we need help. And we have asked for that help a number of times. And we have never really received it. And we certainly haven't received the help to the degree that we need the help. So that 2017 proposal went nowhere. And in the summer of 2019, the hospital submitted a new proposal, which was, in my opinion, a scaled back proposal, which I will say I was very concerned about, because I did not believe that the need from 2017 to 2019 decreased. I still to this day believe that the need is greater. But in any event, I'm not in a position to tell the hospital what it should be asking for and how it should ask. But they made an ask in 2019. And outside of my concerns that, we're not asking for what we need anymore as much as we're asking for what we think the province might approve, that ask went in. And we have not had that ask approved. And I expect maybe we will see that ask approved soon. But the reality is, we will not see the improvements that we need to see in our community until we have the right healthcare available to people who need that healthcare and deserve that healthcare. There was a very important point made during the presentations I want to reiterate. People that have addiction and substance use issues are not criminals. They have an underlying healthcare issue that has to be supported. And I'm proud that the Sault Ste. Marie Police Service does not want to treat them like criminals. The criminalization is in the production of the drugs and the distribution of the drugs. The people who have an addiction issue that are using the drugs should not be treated like criminals. They should be treated like people who need care. And we need to get them care. And we do not have the care available in our community to properly provide for them. And we have with us tonight 3 mothers who have lost children. And they are amongst countless parents and brothers and sisters and grandparents and uncles and aunts and siblings who have lost loved ones. This isn't a partisan issue and it isn't a political issue. Cities and municipalities need care across this province, and the government should provide care equally across this province. There is no doubt the opioid issue is more acute in Northern Ontario. I've spoken to the Mayor of Timmins. I've spoken to the Mayor of North Bay. I've spoken to the Mayor of Sudbury. I've spoken to the Mayor of Thunder Bay. They are all dealing with the same issues that we're dealing with, and they all need support. But I think our infrastructure here is more inadequate than even the infrastructure in those communities. I agree with Dr. Hergot. We do not need to study this any longer. We understand what is happening. We understand the level of care that's needed, but we need assistance to provide that level of care. And we're doing a lot of good work to move our community forward. You're seeing a lot of productive and positive things happening in our community. But the reality is, until we deal with this substantial issue, we cannot entirely move forward because it is affecting a significant part of our community. So all we can do tonight, Dr. Hergot, is tell you that we're with you.
Thank you.
And we're with your group. And we will continue to work with and support your group. We will work with and support SOYA. We will work with and support all of the different advocacy agencies in our community who are trying to get us the assistance that we need. And I want to say to all the people out there that are struggling that cannot get the health care they deserve, that I'm sorry that we have not been more successful in our advocacy. It has been the greatest frustration of the last, all of the years of my mayoralty, that we have not made more progress in this respect. And I personally take my responsibility for that. Notwithstanding that I might have tried, I have not been successful. And there are people in the community that are having a hard time. And I want them to know that their mayor and their council recognize that. And I want them to know that we're trying. And I want them to know that we believe they deserve healthcare. And I'm hoping we will see some progress soon to make that come to pass. And we will take all the help we can get. So personally, I support chat. I support your objectives. And whatever I can do in my capacity as mayor to continue to further them, I will be there to work with you.
Thank you, Mr. Mayor and Council. And I think people have seen that the citizens are coming together. We have hundreds of thousands of views now on our Facebook, and we just need the support of all levels of government. And I do deeply appreciate your time this evening and the very provocative questions that you brought forward.
So thank you, and thank you, Connie. Thank you, Lisa. Thank you, Rhonda, for sharing your stories.
Thank you.
Thank you. Madam Clerk.
Thank you for joining us. I hope you found that to be informative. Please come back next Thursday at 7 p.m. for another episode of Between the Lines. I'm your host, Dan Gray.